Hi everyone, this is Lance Capel. This is Grand Canyon University, and this class is Bio 525. Today I'm doing my presentation on onchocerciasis, which is a skin and eye disease. You probably want to know what is onchocerciasis. This is commonly known as river blindness. This is caused by the parasitic worm Onchocerca volvulus, which is transmitted by the black fly. This is the world's second leading cause of blindness. It affects 18 million people in Western and Central Africa, Latin America, and the Middle East. Onchocerciasis has been a public health threat in the Americas for nearly 5 centuries, impacting hundreds of thousands of people with the threat of severe dermatological conditions, vision impairment, and blindness. Given the clustering of disease near rivers where the black flies breed, the disease is commonly known as river blindness. Since this is called river blindness, the ocular lesions, particularly the damage and loss in visual acuity, are the characteristic features of this disease. Onchocercal dermatitis and subcutaneous nodules are the other important lesions. It is transmitted through the repeated bites of black flies of the genus Similium. The disease is called river blindness because the black fly that transmits the infection lives and breeds near the fast-flowing streams and rivers, mostly near remote rural villages, and the infection can result in visual impairment and sometimes blindness. Additionally, onchocerciasis can cause skin disease, including intense itching, rashes, or nodules under the skin. Worldwide, onchocerciasis is second only to trachoma as an infectious disease. Worldwide onchocerciasis is second only to trachoma as an infection cause of blindness. Next, we're going to talk about the taxonomy of onchocerciasis. Onchocerciasis is caused by the parasitic worm Onchocerca volvulus. Onchocerciasis belongs to the phylum Nematoda, class Cercinetia, and order Spiroidea. The structure is the Onchocerca volvulus has a cylindrical body with a cuticle. It has muscles, reproductive organs, and a digestive tract. It also has both male and female worms, with females being larger than males. So for the structure, the reproductive organs include the ovaries and uterus in females and testes in males. The digestive tract allows the worm to absorb nutrients from its host tissue. Additionally, Onchocerca volvulus has distinct features such as its large size compared to other nematodes and the presence of subcutaneous nodules where the adult worms reside. Next, we're going to talk about the pathogenesis. Onchocerca volvulus is transmitted through the bite of infected black flies. And the name is Similium species, which is the species it belongs to. The larvae are injected into the skin. It matures into adult worms and release microfilariae. The life cycle of Onchocerca volvulus begins when an infected black fly bites a human host. During the blood meal, the fly injects larvae, which is the L3 stage, into the skin. These larvae migrate to the subcutaneous tissues where they develop into adult worms over several months. Adult worms form nodules in the subcutaneous tissue, primarily in regions with thin skin, such as the limbs and torso. Now, the female adult worms produce microfilariae, which is the L1 stage, that migrate through the body via the bloodstream and lymphatic system. Microfilariae cause the characteristic symptoms of onchocerciasis, including intense itching and skin lesions. In addition, they can migrate to the eyes, leading to ocular manifestations such as inflammation, corneal opacities, and eventually blindness, a condition again known as river blindness. The inflammatory response triggered by the presence of microfilariae contributes to the pathogenesis of onchocerciasis and involves the release of cytokines and immune cells, leading to tissue damage and fibrosis. Chronic infection can result in severe skin changes, vision impairment, and disability. Overall, the complex interplay between the parasite, the host immune response, and the environmental factors contributes to the pathogenesis of onchocerciasis. Understanding the taxonomy, the structure, and the pathogenesis of Onchocerca volvulus is crucial for developing effective control and treatment strategies for this neglected tropical disease. Next, we're going to talk about the distribution in Africa. This disease occurs in 37 countries, of which 30 are found in Africa. Africa is the most affected in terms of the distribution and the severity of the clinical manifestations of the disease. 6 in the Americas and 1 in the Arabian Peninsula. Onchocerciasis predominantly affects communities living near fast-flowing rivers and tropical regions, particularly in sub-Saharan Africa, Yemen, and parts of Latin America. The disease has significant socio-economic implications as it primarily affects populations in rural areas where access to healthcare and resources for disease control is often limited. The life cycle of Onchocerca volvulus begins when an infected black fly takes a blood meal from a human host. During this feeding process, the fly injects larvae of the parasite into the skin, which we talked about earlier. These larvae migrate through the subcutaneous tissue over several months, eventually developing into adult worms. Adult worms typically form nodules in the subcutaneous tissue where they can live for up to 15 years, producing millions of microfilariae throughout their lifespan. The release of microfilariae into the bloodstream and lymphatic system triggers an immune response in the host, leading to inflammation and tissue damage. This inflammatory response manifests as intense itching, skin lesions, and in severe cases, vision impairment and blindness if the microfilariae migrate to the eyes and can cause ocular damage. The impact of onchocerciasis extends beyond physical health, affecting communities' productivity and quality of life. Skin manifestations and visual impairment can result in social stigma, reduced educational attainment, and decreased economic productivity due to the inability to work or perform daily activities. Efforts to control onchocerciasis have historically focused on vector control measures such as larviciding and Bennett distribution, as well as mass drug administration programs using drugs like ivermectin. These interventions aim to interrupt the transmission cycle of the parasite and alleviate the burden of the disease in affected communities. Okay, let's talk about the discovery. Onchocerca volvulus was first detected in Ghana by a German missionary in 1890. It was nominated Filaria volvulus by Leuckart in 1893. This was discovered in 1915 by researcher Rodolfo Robles Valverde. Rodolfo Robles Valverde was the Guatemalan physician and philanthropist. He was the first to describe onchocerciasis in Latin America. Robles was the first person to describe the etiology of the disease, correctly attributing it to infection with Onchocerca volvulus parasites. He discerned the etiology from clinical observations among coffee plantation workers in Guatemala extracting the parasitic worm from a nodule on a child's face. The Central Endemic Zone was the first onchocerciasis endemic area to be described in the Americas. It was Robles' work in the CEZ that first described the relationship between the Volvulus infection, the nodule rates, and the ocular disease, and gave rise to human onchocerciasis in the hemisphere, being referred to as Robles disease in the 1930s. Robles also played a role in establishing the first public health campaigns to address onchocerciasis in the Central Endemic Zone of Guatemala, which involved sending teams to endemic areas to provide surgical services and perform nodulectomies. Here is a picture I got online of river blindness, just showing kind of what we talked about, how the black fly bites the host, and showing the cycle right there. So how is onchocerciasis spread? The disease spreads by the bite of the infectious black fly. When a black fly bites a person who has onchocerciasis, microscopic worm larvae called microfilariae, which again we talked about earlier, in the infected person's skin are ingested by the black fly. The larvae develop over approximately 1 week in the fly to a stage that is infectious to humans. An infectious black fly will typically drop larvae when biting a person. The larvae then penetrate the skin to infect the person. Because the worms reproduce only in humans but need to complete some of their development inside the black fly, the intensity of human infection is related to the number of infectious bites sustained by an individual. Blindness is usually seen in the setting of long-standing and intense infection. Who is at most risk for onchocerciasis? So people who live or work near rapidly flowing streams or rivers where there is Similium black flies, Peace Corps volunteers, field researchers, long-term missionaries. Also, other long-term travelers who are at greater risk for being bitten multiple times by black flies infected by the parasite. The disease is most intensely transmitted in remote rural African agricultural villages, which are located near rapidly flowing streams and rivers. Treatment. Ivermectin, which we talked about earlier, is a Food and Drug Administration approved antiparasitic drug used to treat several neglected tropical diseases, including onchocerciasis. Ivermectin has been shown to reduce the occurrence of blindness and to reduce the occurrence and severity of skin symptoms. Ivermectin kills the microphyllae, but not the microphyllae, the adult worms. So it kills the larvae, but not the adult worms. Promising treatments such as dioxazine to kill the adult worms are currently being studied. The introduction of mectizin led to the decline in anterior segment lesions in the eye and the arrest of posterior segment lesions. The drug continues to be highly effective in the morbidity control. Recently, there have been reports of suboptimal responses in some adult volvulus, albeit in very few small, isolated foci. Prevention. The best prevention is avoiding being bitten by infected black flies by using insecticides that contain N,N-diethyl metatautulamide on exposed skin, wearing long sleeve shirts and pants, and wearing permethrin treated clothing. There's neither a vaccine nor a recommended drug available to prevent onchocerciasis. And this chart here showing the prevalence of onchocerciasis in Africa and Yemen in 2000 through 2018. And you can see here the differences here. from the early 2000s compared to 2018. And you can see there's been a decrease in some of these countries here in Africa and also Yemen. These are my references here and here. And I hope you enjoyed my PowerPoint presentation. I really enjoyed researching this disease, and I learned a lot. Hope you were able to gain some knowledge of this as well, and thank you for your time.